Hello friends, good evening all. I am Dr. Kodes. Welcome you all to my YouTube session. Today I am going to deliver a lecture or a presentation on ruminal acidosis in brief, and I think this will be very much helpful for you, and especially those people who are dealing the patients or dealing the animals in field condition. I think this video will be more helpful to them. So, as you know, this is the season of many festivals, many marriages, many parties in both town and was rural areas. So, what happens in the leftover things from the dinner? We just throwing them out, and the animals those are roaming day and night around the cities or around the village area. They just take that leftover things. So what happens, they exhibit a certain types of symptoms that simulating some nervous symptoms, and there is bloat like conditions, and and there is in many instances there is sudden death also. So let's discuss what's the disease and how it generally manifested, and the mechanism of this disease. So let's have a brief view of the disease. So this disease is nothing but we are calling it just the ruminal acidosis, and we are calling some people are they are calling the carbohydrate engorge carbohydrate engorgement, and this carbohydrate engorgement is the synonym of that disease. So let's discuss what is the ruminal acidosis, its therapeutic management. Basically, this is a disorder of ruminants, means those animals who have ruminants like cattle, buffalo, sheep, and goats. So this disease causes a great loss in production, that's morbidity, and causes a heavy mortality stock if they ingest a heavy amount of your leftover things. And this disease is morely encountered in very good pastures. Those animals who are in very good also habituated with the grain feedings. So these are those people, those animals are mostly susceptible that these diseases. So this is a many a pathological conditions due to the accumulation of heavy amount of digestible carbohydrate in the body system. Definitely. So this is a condition when we take or animal takes a heavy amount of fermentable carbohydrate. This in this condition, the blood pH as well as the rumen pH suddenly declines to a very threshold point, and that causes a very significant threat to that animal. So this is also known as grain overload or grain poisoning or ruminal lactic acidosis. These are the synonyms of that disease. Coming to the next, the etiology, the causative things of that disease, why this disease is occurring. So it is nothing but sudden ingestion of the toxic dose of carbohydrate in feast or in marriages parties, the leftover things. These are nothing but uh, the easily digestible carbohydrate, and these are taken by the animal suddenly as well as in a heavy amount. So the feeding of ruminants of marriage parties or festival as rice, dal, or any other fatty preparation leads to that disease. So some scientists are telling feeding of more concentrate in order to gain more productions, by some owners also predispose this to the disease. So this is nothing but increased fermentable carbohydrate in the ruminal acidosis causes growth of the bacteria like Streptococcus bovis, and this growth of the all bacteria causes your increase in volatile fatty acids. So there are three types of volatile fatty acid present in the body: acetic acid, beta hydroxy butyric acid, another the acetone. Okay, so these three volatile fatty acids, their concentration suddenly increases in the body, and that leads to decrease lowering of your pH. So lowering of the pH leads to your ruminal acidosis. So lowering of the pH causes lactic acid production, and this lactic acid production inside the rumen causes decrease of pH of the rumen liquor. Coming to the last slide, so this is a very simple phenomenon, like osmolality of the rumen fluid increases, And when the concentration inside the rumen fluid increases, like you're lowering over pH, it drags the fluid from the body system, the cardiovascular system. So from the cardiovascular system, when the fluid draws or the fluid get rushed into the rumen, then obviously the ruminal content of the rumen size increases, as well as because there is a heavy amount of fluid in it. And from the body system, from the cardiovascular system, from the lymphatic system also, the fluid depletes, the fluid amount getting lowered, and that leads to your dehydration. And the excess fluid in your rumen causes bloat like symptom. So decrease of your fluid in the cardiovascular system causes very high rise of RBC in the blood picture. That is nothing but hemo concentration and the increased packed cell volume. And the decrease in the cardiovascular, the decrease of the fluid in the cardiovascular system causes low production of the urine. That is oliguria. In toxic doses, if it taken toxic doses, there is total cessation of your urination. That is anuria. So in this condition, a typical type of bacteria proliferates inside the ruminal content, that is Streptococcus bovis and Lactobacilli. Another fungus also there, Mucor in the Absidia, further causes lowering of your pH. And you know, there if there is very if the pH come down to a very toxic or to a very lower pH, then there is chances of gangrene of your rumen wall. This is also very important because the volatile fatty acids, those are generally absorbed through the rumen wall. In the scientists also revealed that there is increased secretion of the histamine, because it is this is a type of not this is not directly like an allergic reaction, but it is a type of any toxic principle is working. So histamine secretion is there. So this histamine secretion causes ruminal stasis, means the rumen functions, the rumen contraction and expansion become become static, because this does not work at all. And that histamine also causes laminitis, means there is inflammation of your joints, and there is coming to the next. So what are the clinical symptoms generally we encountered when we find these types of cases? So first of all, we have to take the history of the feeding. We have to ask the owner where they did the previous diet, where you have let the animal to roam. So all the things you have to take the history. So history part in veterinary practices assures you or make them sure your 90% of your medications. So there is onset of illness and depression, and there is distended rumen. As there is more fluid inside the rumen, this causes distended rumen like bloat, suspension of rumination, and anorexia. There is complete cessation of your intake of your food. Watery to foamy diarrhea, because the rumen is filled with water. The obviously the fecal material is watery. There is no, as there is pain inside the rumen, there will be kicking and looking the belly frequently, because when there is some internal pain inside the like intestine, like in rumen, when there is pain exists inside the rumen, then the animal generally looks to its belly. In mild form, or when it takes a very low amount of your fermented digestion, there is anorectic, okay, slight anorectic, bright alert fishes, short fishes, and abscess of ruminations. But in case severe form, when the animal passes through a 24 to 48 hour and it is untreated, there is staggering, tremor, pressing, grinding of the teeth, not drinking water, and obviously there is a pulling of your water from the cardiovascular system. There is dehydration. Even 10 to 12% is more, because it causes such a death. So sometimes the temperature becomes subnormal. It is below 101.5 degrees Fahrenheit. There is shallow respiration and increased heart rate and tachycardia. So generally, we are dividing the whole ruminal acidosis into three categories. One is acute ruminal acidosis (ARA), that is subacute ruminal acidosis (SARA), SARA, and chronic latent ruminal acidosis (CLARA). But out of all these things, the second one is also very important, because SARA, subacute ruminal acidosis, don't confuse with another disease, SARA, 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 that is nothing but trypanosomiasis. Let's see what is the subacute ruminal acidosis. mostly found in field condition that goes unnoticed. We cannot detect that conditions, and there is less appetite, lower ruminal motility, and mild diarrhea with depression. So laminitis is the main clinical feature. Just you see the coronary groove of the or the uh, hoof of the animal, and you just see there is a ridge in dorsal wall of the hoof and sole ulcerations. So don't be confused with ulcerative laminitis or any FMD like that symptom. Don't. So first you should take the history. So there is limb abscess and epistasis, that is coming oozing of the blood from the nose. The epistasis with pulmonary hemorrhage. So what we should do, like as we are veterinarian, so first we have to puncture the your rumen through a trocar and cannula, or so you just collect some ruminal fluid. So when you find such type of cases like blood like symptoms, just you just put your probang inside your through trachea to the rumen, or you can go for directly ruminocentesis, that is your puncturing of your rumen. So you just when you are when in this pH paper, we you just dip it in the Roman liquor, you find the pH is below 5. Generally the pH is generally 5.5 to 6 in between. So when this goes beyond 5, then you ascertain this is a case of acidosis. So the color is just milk gray to greenish. Generally this rumen liquor, the rumen content is straw full like color. So when it become greenish, you also have suspect that this might be a case of your ruminal acidosis. So the protozoa very nil, and the ruminal bacteria, there is more proliferation gram negative, very important. Generally inside the rumen, the gram negative bacteria is more prevalent to gram positive, but when we find a case of ruminal acidosis, the gram positive bacteria concentration get increases to manifold. So histamine level also very rise, also is very significant clinical feature. So you just know, I have told you the hematocrit value increases, and there is also increased rise of the blood lactate and decreased level of the bicarbonate level inside your blood. So just see in broad apple load or in ruminal acidosis, mild 5.6 and moderate 4.5. When you just see the severe cases, the ruminal is just declining and the heart rate is inclining. You just compare. So in some researchers, some scientists or some physicians are telling, when you find a heart rate more than 120 per minute and pH is below 5, then you directly go for ruminotomy and just evacuate the rumen material to outside. In case of sheep and goats differ from cattle in rumen function. You know very well. Feed tends to pass quicker through the rumen than the cattle and sheep, and to have a higher incidence of intestinal disturbances compared with cattle. So coming to the differential diagnosis, how can you differentiate the ruminal acidosis from other diseases like milk fever, TRP, traumatic reticulopericarditis, nervous form of ketosis, hepatic insufficiency, and the simple digestion? Just you ascertain. So in milk fever, there is history of recent parturition, means 24 before 24 hours. And traumatic reticulopericarditis, you should go for the bamboo test first. Means you just let the animal to walk from a high point to a low point. When the animal does not work, then you should ascertain that might be a case of your TRP. And in TRP also you find a case of the increased level of immature neutrophil, that is your shift to left condition. And there is nervous form of ketosis. There also you have to ascertain the history of calving, history of parturitions. So in ketosis, there are two forms of ketosis. In another lecture we are going to discuss the digestive form, the nervous form, and hepatic insufficiency in the simple digestion. So line of treatment, as I have told, we have to evacuate the rumen first, because there is accumulation of more amounts of fluid in the your rumen. Second thing, the pH, that is there is a great imbalance between the pH between your rumen as well as your blood. So we have to first increase the pH of the blood and restore the fluid by the electrolyte loss. Very very important. So and the we have to hasten or we have to accelerate the intestinal movement, because the ruminal content can be evacuated through the anus in a very short span of time. Ruminotomy in case severe case, if heart rate goes beyond 120 per minute. So a transfer of fresh cord rumen, this is the most part. If you have any opportunity that after evacuating your ruminal liquor either through ruminotomy or through any probang, then you just give any cord, means any rumen liquor from the other animal like in slaughterhouse and from the other sources. You can transfer from directly from outside from other to the affected animal. So this is a very important one, because in many cases I have seen and I have practiced it also. This works very good. And checking the systemic acidosis by the 7.5% sodium bicarbonate. We have to give IV 1 to liter per animal. So then this causes in my condition that if 25 ml ampoules are there. So you just calculate how many ampoules do you require. So and there is also we have to administer the alkalizing agent either intraorally or intraruminally. Magnesium dioxide, the gelsils, they are available very easily. So to increase the rumen pH, and the fluid is very very important, because we have to compensate the electrolyte loss and the fluid loss from the outside. And generally we do not go for the RN, you just prefer the NS first. Very very important. RL and NS, sorry, RL and NS you go, this is most important. Don't go for DNS, because already there is dextrose, means there is increased level of carbohydrate in the fluid. So either LS or NS. And some in some scientists or some research papers they are calling, if you do not have availability of the RL and NS, then a simple concept that any fluid is better than no fluid. Any fluid you have available, then you should go for that. The supportive therapy include the antihistaminic, because there is increased level of the histamine, and NSAID to prefer non-steroidal anti-inflammatory drugs like meloxicam, diclofenac, sorry, not diclofenac, ban, meloxicam, ketoprofen, analgin. All these things you can use. Prebiotics and probiotics to multiply the numbers of your microflora and microfauna inside your rumen. Then calcium borogluconate to hasten the intestinal motility, nothing else. The tetracycline tablet, because there is increased level of the gram positive bacteria inside the rumen. So tetracycline is a very good choice of drug. And there is prevention control. So there is strict supply of drinking water in acute cases, very important. Adequate supply of fiber during the lactation, secret monitoring of the daily feeding of the schedule. Affected animals should be removed and fed in a separate house. So I have collected all these information from the blood, the book Blood, the Amlan Chakravarti, the Das SKPP from the Handbook of Veterinary Practitioners, and the Intest Polivate, volume 11, 2010. So I have just, because in my college time the teachers always asked to write a prescription for you, the ruminal acidosis. This prescription is my perspective, so don't use it, or don't according to the there is also as indicated by the veterinarian. So please first consult a veterinarian first, then go for the treatment. So I am just giving you the illustration of a prescription I have given. So sodium bicarbonate is 7.5%, 50 ml ampoule. I have used 10 ampoule. So to check the systemic acidosis, the ringolactate solutions, the Bob's John is a Intest company. So this is a Roman alkalizer, antihistamine drug like anhistamine, or ZEET like your alembic, or the Golergy your Vetmankind. So try vet to check the laminitis type of conditions. Then Ecotas bolus, it is a nothing but a your prebiotics probiotics by the Intest Pharmaceuticals, and there are also many other preparations also there. I want to tell you one thing, that I'm not going to brand, or no, I'm not going to promote a specific or a specific pharmaceutical company. And the melonus injection to it is a NSAID to prevent the shock. If you have any doubts in your mind, and if any queries, or if you want to give any valuable suggestion to this lecture, then please give your feedback in my comment box, so that I can improve my efficiency as well as the professional competency in future. Thank you.